Hello and welcome. You're watching NDTV on YouTube now, and this is the top story segment. Every morning on Good Morning India, I give you 5 options, 5 stories that you want to hear most about, and what you vote the most is what we discuss in detail here on YouTube. So let's go and see what the top stories for the day were. Well, we give you 5 options, and the maximum voting percentage of 68% has gone to severe pollution levels in North India, followed by the key meetings in Delhi today about Maharashtra government formation, followed by Mamata Banerjee and her tiff with the Bengal governor on phone tapping. And then there is odd and even rule, and then there is a striking Telangana transport workers who finally begin work today. But 68%, that's, if I'm not wrong, from the past several top stories that we've done, this is perhaps the maximum percentage we've got so far on one concentrated story. So that's the interest people have on this so far. But the irony in all of this is the fact that not much is being done about this issue as we speak. So what are the big 5 takeaways before we go to our guests as well here with us to give you an in-depth on what can be done, what should be done in a scenario like this? Number 1, at the moment, odd and even scheme has been kicked in the national capital. That means odd number plates on odd days, even number plates on even plates will be allowed to apply. If you violate that, there is a charge and a penalty of 4,000 rupees. It's gone up from 2,000 last year. So that's something to keep in mind. This has been kicked in because the AQI levels in Delhi are the worst in the past 3 years. This despite several mechanisms and measures being taken by the Delhi government already, but it doesn't seem to be working. The fallout of these high AQI or pollution in the air is that schools had to be shut since it's dangerous for kids to go out. So private schools, government schools in Delhi and NCR, not just Delhi. Last year it was just Delhi. This year it's Gurugram, Ghaziabad, Noida, Delhi. All of them have been shut. There have been advisories being given out to corporates to try and work from home and ensure that they are not on the streets, because that's how dangerous the levels are at this point. I have with me a doctor and an activist, and we'll try and get both the perspectives for you at the moment. The debate when it comes to the issue of air pollution has been that nobody, and when I say nobody, let me say very few at this point, have understood the impact air pollution has on our lives. This includes very few citizens who've not managed to make it in electoral issues and not been able to turn it into one, and includes politicians who did not have it in their election manifestos as well. The recent Haryana and Maharashtra elections are a perfect example of that. I have with me somebody who's now getting on with a citizens' charter asking for an urgent intervention by nobody less than the Prime Minister himself to look into this issue. Now, the silence from the Prime Minister has been criticized all over, criticized to the degree that it has now become a war between Aam Aadmi Party and the BJP. The extent to which has gone where the very senior leader of BJP, Vijay Goyal in the national capital, came out and said that he's going to openly violate odd and even because it does nothing. In fact, he went out to say yesterday in a statement on an on-camera bite that if the Modi government does everything, what will Kejriwal do on the issue of odd and even? Do you think, as a citizen of Delhi, this is something you expect out of your politicians at this point?
I think it's very petty. I don't think Mr. Goyal is breathing the same air that you and I are. I think maybe he has air purifiers installed in his house. As a citizen, the least I can do is, if not compliment the measures that are being implemented, let's not try and be disruptive, right? At least say that, fine, I'm not going to take my car out. How is that going to help the situation? And the reason why we put out that letter to the Prime Minister as an urgent appeal is citizens are frustrated to not hear a word from the Prime Minister on air pollution in the last 5 years. And I'll give you an example. What's baffling is even different government agencies within the central government, they have a different attitude from center and state. And in the central elections, we saw BJP in that many words saying that we acknowledge air pollution as an issue and we are going to fight it through NCAP. 6 months later, they go for elections in Haryana and Maharashtra. Gurugram keeps coming as one of the most polluted cities, sometimes even toppling Delhi. And Maharashtra is the most polluted state in the country with 18 cities, according to CPCB. Not a word of air pollution in their manifesto. So it's very surprising because I expected at least the central manifesto to reflect in the state one. Nothing.
The flip side and the flip argument to this is that this is because the electorate has not managed to turn this into an election issue. Since it's not impacting them, they haven't managed to convince the government. People like you are now trying to get together people, galvanize support on this movement and tell the politicians that you have to care. But the support that you have so far, is it ample?
I think the government does not need to wait for people to hit the streets like they do for Bijli, Sadak, Pani or other issues. I personally believe that
in a case like this, you're advised not to go out at all. So
definitely. In fact, I mean, the government, I believe, is trying to hide behind numbers. That is not what is supposed to be. The statement that came out yesterday from the principal secretary that we are going to monitor the situation. We have a doctor as the next guest, but whatever I understand as far as monitoring is concerned, if a patient is critically ill, you put the patient in monitoring after you've done everything in your capacity to see dekhte hain kya hota hai. Has the government done everything to address the issue? I don't think so. Just
for our viewers who don't know about this meeting, let me just put that in context for you. The only reaction that we've had from the central government on the issue of air pollution has been that the principal secretary late last evening called for an emergency meeting. He spoke with his counterpart in other states and asked for an urgent report, asked for 24 hours monitoring and asked for daily updates. But the criticism here is that the time for updates is over, time for monitoring is over, time for action is now, which seems to be missing. But to take away from what we were discussing a little earlier on and to talk about how is it that the same air that we breathe, and we are in NDTV Newsroom right now, that's why we have air purifiers on, so we don't have our masks. In the earlier broadcast, this is where we were on the rooftop earlier on and we had masks on as well. And the minute, doctor, I took my mask off, I could just smell smoke. I'm still coughing, and this is a sustained thing that we are seeing with almost everybody around us. So it's a reality that people are sort of okay with. But to those who still do not believe that air pollution is a killer, what do you say to them?
See, basically, it's not just me who's saying this, but there are WHO, the World Health Organization, has actually recognized air pollution as a single most hazardous risk factor to our health. It's the number one single most hazardous risk factor to our health. It's been labeled as an invisible killer, but now we can see the smog by our eyes. So, from micro killers, it's actually become a macro one now, where you can actually see everything around you. Despite that, there is a sense of denial I can't understand. If you go historically, it was way back in 1952 sometime in December, in the month of December, between 5th December and 8th December in London, when they encountered this huge smog. It was a windless day. There were anticyclonic conditions, and they were probably at that time using coal as their main fuel of combustion. There was so much of smog that 4,000 people died in those 4 days, between 5th to 8th of December, between a Friday to a Tuesday. And about 1 lakh of people fell sick because of that. Subsequently, when they analyzed the data, they actually realized that it was 12,000 deaths, not 4,000 deaths. And we are talking about 1950s, when as it is the population was so small of the London city. So we've known about it since then. There are enough studies to say that there are such severe ill effects of air pollution on our health, and these ill effects start from the time when the child is still in utero. That means still in the womb.
I talk about now. Last year, at the same time, I went to doctors and I went to hospitals and to dispensaries, and the overarching number that I got was about a 20% significant increase this time of the year. Is that what you're sensing this time around as well?
Yeah, absolutely. I mean, there's no difference in that. The numbers definitely go up around this time of the year, not only of the people who are coming to the OPDs to show themselves, but also of the people who are coming to the hospital as an emergency for hospitalization.
Give an example, who comes with what?
Basically air pollution. So there is a study from All India Institute of Medical Sciences, that's about a few years back. It was conducted, where they actually showed that the number of patients coming in with an acute heart attack, an acute exacerbation of bronchial asthma, an acute exacerbation of chronic obstructive pulmonary disease, COPD, goes up by nearly 20-25% depending on the AQI level. So when the AQI levels are very poor or very high actually, that is the time when these admissions go up significantly. So it's been known for years. We're not discovering it now. It's like reinventing the wheel that we're
Just to get a perspective here, the people I see most impacted by this, and I'm just talking about a general section of people all around me that I see, people who have kids at this point are the most alarmed because they see a significant, kind of drip and drop in their health. Pregnant women are being advised to leave Delhi altogether. I just want to get a very first-hand approach from you. Is this an exaggeration at this point to leave Delhi, to go somewhere else because there's simply no solution?
No, so I would not call it an exaggeration. It's a reality that we need to face it. There's a vulnerable group, as we categorize them as. This vulnerable group basically includes children less than 5 years of age, elders more than 65 years of age, pregnant ladies, all those people who are suffering with chronic bronchial asthma, chronic obstructive pulmonary disease, a chronic heart disease, those who are suffering with any kind of cancers, are on immunosuppressive therapies, are taking steroids for prolonged periods. So this is the vulnerable group. And there are very clear-cut standards and measures that have been advised, recommended by bodies across the globe, where they say if the AQI level is more than 200, that is the time that this vulnerable group should restrict any strenuous physical activity outdoors.
And as we speak, it's about 700.
I'm just coming to that. So, when it is above 300, then they should not be moving out at all. And when it is 400, then none of us should be moving out at all.
None of us. Even the healthiest person in Delhi should not be venturing out. That's what you're saying.
Equally prone to having some problem or the other. May not be acute, immediate. It may not happen tomorrow or day after, but it can have long-lasting impacts. So if I was to, enumerate the various impacts that air pollution could have on our health, it starts from simple allergies, like an allergy of the eye, watering of the eyes, nose, nasal congestion, stuffiness, running of the nose, skin itching, dryness on the skin, burning. Some people even come to us with burning of the skin. Then sore throat. All this happens when the PM, the particulate matter outside is 10 microns and above. As we go on to the smaller particle size, like a 2.5 or 1 micron or less than 1 micron.
Which, mind you, even the mask that you wear does not keep away. And that's going straight into your blood vessels, there's no coming out.
Absolutely. So they enter the lungs. Lungs form as the entry gate for all these particulate matters and the toxic gases. So there in the lungs, it triggers off a cascade of inflammation, which then results into the systemic effects. So besides asthma, allergies, chronic obstructive pulmonary diseases, chronic lung diseases, lung cancers, there's a new disease entity which is now being linked with air pollution, which is called the hypersensitivity pneumonitis. There was a recent study from our own country where we've actually shown that the number of patients of hypersensitivity pneumonitis were much higher in all those cities where the AQI levels were very poor or very severe.
So let me just come to the long story short over here. Air pollution kills. Some will be impacted immediately, some will see its effects in the long run. The sad part is that no death certificate, and that's something that is highlighted in your petition as well, that no death certificate says that you have died because of air pollution, but in days to come, more and more deaths that are being reported, these are life and death issues that we're talking about, are happening because of the air we breathe. And if something...
we'll have something like a death certificate also saying that you died because of air pollution, because now they're working on trying to find out if there is any particular biomarker inside our body or any particular chemical that could be isolated either in the blood or in the urine or any other sample of the body
to clearly say
that this is because of air pollution. So work is going on that, and I'm sure we are not far that we'll be able to
I really hope that we don't have to wait that long for action to be taken on this. I just hope that the evidence, which is very apparent all around us at this point, is enough for the government to take action. Sadly, at the moment, we are not seeing much apart from the odd and even scheme that we see out by Delhi government, and we really urge you to go out with that as well. There's a whole another debate altogether of whether or not odd and even helps, but we'll get into that some other time. For the moment, thank you for joining us on YouTube. See you again tomorrow morning with the top stories, with the stories that you have voted on.